Hello, I'm Maura Carley, founder and president of Healthcare Navigation, and today I'm hoping our topic will be simpler than some of the past couple topics. We've been focused on Medicare for a while now, and we've talked about Medicare A, B, C, Advantage plans, D, and private Medicare supplements. And today I want to begin with an introductory video into how one gets onto Medicare and when. And there are a couple of groups we're going to leave out because otherwise our videos would be so long. So there are people who are eligible for Medicare prior to age 65. That's due to serious illness, disability, and so on. And perhaps down the road we'll have a separate video for them. And then there's another group of people who have to go through the Railroad Retirement Board to apply for their Medicare A and B. But I'm sorry, but we're going to leave you out too. And we're going to talk about the vast majority of people who go on to Medicare at 65 or postpone it because they have active group coverage. And then we're going to also mention the enrollment period for those who unfortunately didn't follow the rules along the way. So let's start with a definition of the initial enrollment period, and that is the 7 months around your 65th birthday. It's 3 months before your birthday, the month of your birthday, and 3 months after your birthday. Now, almost everyone needs to be considering prior to their 65th birthday, do I need to do something? And if you have individual coverage, technically you could keep it when you turn 65, but you want to transition on to Medicare because Medicare has rules and enrollment periods and you don't want to miss them. And so we'll talk in greater depth about the initial enrollment period in a video just devoted to that. But if you're on individual coverage or you're on COBRA, you want to transition to Medicare at 65 during your initial enrollment period. The people who have a pass are the people who have active group coverage through their employment or a spouse's, and the employer has 20 or more employees. The small group, meaning under 20 rules, vary by state and can vary by plan, as we've discussed in a previous video. Now, something else to note that is important is even the people who are going to get on Medicare Part B through a special enrollment, most should consider enrolling in A around their 65th birthday just to get their Medicare number. The group that would not want to consider that are the people who have a high deductible health plan because, again, it's an IRS rule that if you have a health savings account associated with a high deductible health plan, then if you're on Part A, you are not supposed to contribute to it, and your employer is not supposed to contribute to it. So in that circumstance, or if you're thinking your employer might offer that kind of plan and you might be interested in it, then you shouldn't enroll in Part A at 65. I do want to point out an important issue because I've talked about Medicare enrollment rules being punitive, and they are for Part B and Part D, but they are not for Part A if you're an individual who earned premium-free Part A through your own work or a spouse's employment. So if you are continuing to work, especially for a large group beyond age 65, you can defer enrolling in Part A. You just need to plan so that you have that number, that Medicare number, far enough in advance to do your Part B enrollment and enroll in the other products we've already discussed. So let's talk about the special enrollment period. The special enrollment period applies to people who continue to have active group coverage beyond age 65. And it starts after the initial enrollment period, which is, as we mentioned before, 3 months after the month of your birthday. And you're in a special enrollment period that entire time you have that active group coverage. Remember, the people who work for the employers of under 20 have to figure out if they need to be on A and B, and the people who are working for employers of 20 or more do not. And most of those people will choose to get on Part B when they retire, because Part B is a part of Medicare where you have to pay a premium, unlike Part A for most people. So if you're going on Medicare through a special enrollment process, you would already have your Medicare Part A in place, and thus your Medicare number, and you would go on Part B and typically the other parts of Medicare to coincide with the group coverage ending. So the active group coverage would end on a day at the end of the month, and Medicare would begin the next day, Medicare B and associated products. And we'll discuss that in greater depth in our special enrollment video. And so let's wrap up with the general enrollment period. That is not the recommended way to get onto Medicare. It's usually the way people who weren't aware of the strict enrollment rules get on. And it's the first quarter of every year for a Part B effective date the following July 1. And so for most people, it involves a gap in coverage and Part B premium payment penalties for life, which can be most unpleasant. So we want you to plan ahead so that you never have to use the general enrollment period. And we will do separate videos on each of these. I thank you for listening, and we hope to see you soon. Take care.